Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. With your shoulder, what happened?
So I developed some tendonitis here in the bicep. It started out just like a stabbing pain here, and then started having burning here, kind of pain across here, and then it's over time it worked up into my neck, all the way down into my wrist, and then it was just pain, and then it developed into suddenly I couldn't move my arm.
How long has this been going on?
At least 4 to 5 months.
4 to 5 months. How did you hurt yourself?
I think that it started with first maybe a tray that I had at work for typing, but primarily I think it was the use of my cell phone, and I put a new cover on my cell phone. It had ridges and smooth places, and then I thought it was making me hold my phone different than normal, and I was having to use my phone a lot then. When the pain got so bad up here, I stopped holding my phone, and I started using it with my right hand, and then I started getting that same pain over here. So I tried to not use my phone, put a new cover on it, but even just putting the phone like on the desk and using a stylus, it will hurt here.
On the other side, but most of your pain on the left side.
The severe part is over here.
You're left or right-handed?
I'm right-handed.
Right-handed, okay. So for the last 4 or 5 months, what kind of treatment did you have for your shoulder?
I just went to the doctor for it, and the doctor prescribed prescription Aleve twice a day, and then icing it several times a day, and then said once the pain went away I could start trying to stretch it, but anytime I try to do any type of stretching,
it causes more pain?
It causes more pain.
Did you have any like acupuncture, massage, chiropractor? What kind of treatment you had for your
I
shoulder?
went to my normal chiropractor. He said he can't really do much for that type of injury. And then the acupuncturist did a couple treatments, and it did seem to slightly help.
Okay.
And then massage.
Massage.
But it's so sore, like that type of massage.
So
Just really.
it was deep massage, deep tissue.
I'm not sure what.
Okay, like really rough on the body, or just gentle?
Probably more gentle because it hurts so much. Yeah.
So how much pain do you feel there from 0 to 10? 10 is emergency room. At worst.
Well, it'd have to be pretty bad for me to go to the emergency room, but I would say through most of this, the last couple months, it's been probably like at an 8 or 9.
Okay. And do you feel constant pain there?
It's constant pain. And
so constant, how much from 0 to 10?
I would say probably like the constant pain is probably more of a 5.
5 constant, and when you raise your arm, that's increased.
Yeah. Okay. If I can't close my car door, like you have the normal car door handle to close the door. If I forget out of habit and I grab that, it will just feel like it just like rips, like feels like it just shreds the muscle or something. I don't know how to describe it.
Yeah, stabbing pain, sharp pain. Okay.
Yeah, and then that sets.
So any like resistance or kind of like pushing and pulling and stuff aggravated.
Yeah, even trying to, like yesterday I tried to tear a paper towel in half, and that
paper
hurt.
towel.
Paper towel, and that hurt. Like to open I tried to open a package the other day.
So you lost a lot of strength.
Yeah, I don't have much strength in this hand at all, and I've started noticing strength going away on the right hand now.
Oh, okay. All right. So I want you to do the range of motion that aggravated, and let me know from 0 to 10 how much you're pain. You said like constant pain, how much?
Probably about a 5.
5 constant pain. So I want you to let me know when you do the range of motion how much that pain increases. So let's actually let's do this. Bring it up as far as you can, and tell me how much pain. And let's see the other side. So both sides. So the range of motion on the right is okay.
Yeah,
but it's very limited.
The day before yesterday, when I had my hand up grabbing something, I did notice pain in the top of my arm on this side now.
Okay.
So
you want to focus on the left for now?
Yeah.
And then we'll do the right later?
Yeah.
Okay. So let's do the abduction. Thumb up here and bring it up like this. That's very limited. You did not even like, you were barely 90 degrees. Well, I will measure your range of motion. Can you do this?
No. I mean, I can kind of touch there, but this is fine.
And tell me how much pain with those motions.
Like it does spike up
How much would you do?
I'd say today is not so bad, so maybe like a 6 or
6,
7.
okay, bring it back.
I can't do that. I can do it fine. This arm just feels tight.
Okay.
The right.
So, and your doctor says it's tendonitis?
Yeah, she said bicep tendonitis.
That was 4 months ago, yeah?
Yeah.
Okay. So we'll have you lie on your back,
Okay.
hit here. So flexion is almost 85. Can you see that? Can you see this? That is 70. Can you see it? Sorry. She's making faces. Here we go. Can you see?
Yeah.
70 degrees. So, okay. So bring it back. You wanna get this shot? You cannot take it any further. So external rotation, look at here. That is like 8. Can you see that? 8. External rotation, can you bring it in? Sorry. So you're very limited. Okay. So 8 and that is 35. You see that? You can
Right.
Yeah, classic frozen shoulder, you have decreased range of motion and flexion, abduction, external rotation. So that's very common for disused
Okay.
shoulder joint. Is that painful?
No.
Is that painful here? Any pacemakers or seizures or anything like that? Okay. How's that feel?
Fine.
Okay. So you said the stabbing is on that spot, yeah?
It's like right out in here, more on the outside.
On the outside, okay. How does this feel?
Okay.
So which emotion is worse? Pain is flexion or abduction or going out?
Probably the worst is if my arm kind of is down and back,
Going backward.
and it like
yeah, reach
pulls
backward.
it back. Yeah.
Mm-hmm.
Like sometimes like trying to pull your blouse down, and you kind of just forget because it's just habit. It's like, dang it.
Yeah, I'm sorry. You probably any movement is just a reminder of your
Yeah.
shoulder. And you said you start to have issues here.
Yeah, it goes all the way down to the wrist.
Mhm.
Some days it's worse than others.
Is that painful what I'm doing? It's okay.
A little bit.
Make sure everything pain-free. I
Okay.
don't want to increase your pain, so make
Okay.
sure you communicate with me.
Okay.
Because, pain is indication of inflammation.
Okay.
You don't want to rub over inflammation
Okay.
from there, so make sure you communicate
Okay.
with me, okay? So I'm gonna work on the proliferation stage now, using the tools to release the scar tissue, the fascia restrictions, and see how much range of motion we get.
Okay.
Okay? So if you purely stuck in the proliferation stage, we should get really good range of motion
Okay.
with the tools that I have here.
Okay.
If not, I'm gonna jump to the working on the inflammation
Okay.
stage and use the magna heal, but I will wait for that until to see how we respond
Okay.
to the other tools, okay? I will show you the scar tissue you have, okay?
Mhm.
You feel that grinding here?
Yeah.
Those bumps?
Yeah.
Those are scar tissue. When you don't have a scar tissue, it should feel like nice and smooth,
Okay.
like this
Okay.
area. But here,
Yeah.
and you see redness where scar tissue.
Oh, interesting.
You see that?
Yeah.
And you feel that like rocks and grain
Yeah.
feeling? Yeah.
I thought that was just like your veins or tendons or something.
Well, you should not have a scar tissue and a
Mhm.
muscle like this. Your muscle should be like really nice and smooth.
Mhm.
When you have like repetitive strain injury, like a lot of typing or
Mhm.
holding something with the poor ergonomics,
Mhm.
you start to have like a micro tear in the muscle
Oh, okay.
or the tendon too.
Okay.
So your body starts to build a scar tissue in that area.
Okay.
But when you do it for a very long time, it's a layer over layer of scar tissue.
Mm.
After a year or two, that's start to be
Mhm.
knotted. Does that make sense?
Yeah.
That's if we don't know the mechanism of injury, like fall, accident.
Mm-hmm.
You know, it usually happens over time from bad mechanics
Okay.
or ergonomics. And I'm not surprised with this because you said you're doing desk
Yeah.
jobs, so a lot of
Yeah.
typing, yeah. So
Mhm.
I'm not surprised that's more scar tissue here. Let's actually try to see your range of motion now.
Okay.
Okay, so thumb up, bring it up, and tell me how that feels. How's that?
I think it feels a little better there.
You're going a little bit further.
Yeah.
Yep. Okay.
Yep.
Do it one more time for me. And if you feel you can go further, you go. Good. Let's do the side
Which way?
and up. Even that a little bit further. Bring it back. The last motion you're gonna gain is the external rotation back.
That definitely goes back farther.
It goes further. Can you do this?
This
Mhm.
one's fine.
Okay. So can you tell the difference?
Yeah, it doesn't feel all the tearing.
That's tight.
Yeah.
Remember you said you fracture all of your reps. But for your head.
I was only 18 years old. I can't remember.
You feel that tightness here?
Mm-hmm.
That's a lot of fascia tightness. Fascia, the superficial layer, it's like a Spider-Man suit wrapping the entire body.
Mm.
So it's a very thin layer under the skin wrapping everything. That's the superficial fascia.
Mm.
So when that's tight, it's similar to you're wearing a t-shirt 2 to 3 size too small.
Okay.
Okay? So, and you already said in the history, like you get a lot of migraines.
Yeah.
How often?
If I don't work a couple days from home,
Mhm.
I'll get at least one a week, sometimes
Mhm.
2 a week
Mhm.
if I'm in the office.
Mhm. I want you to keep track how the migraine feels when I work on you.
Okay.
Okay? I personally used to have migraines
Okay.
before I invented ASTR. Well, if you get migraine once or twice a week, that's a lot.
Mm-hmm.
You should not have that frequently. You feel this bump here?
Yeah.
That's a scar tissue.
Oh.
You know, compared to this, well, scar tissue here. It's not too bad here compared to this.
Mm.
This is usually from clenching and grinding.
Mm.
And here, you feel that?
Yeah.
Sorry, is it painful? It's okay.
Not painful, just
Sensitive?
yeah.
But you hear that sound and
Yeah.
that's from clenching too here.
Interesting.
And relax. You feel how tight your fascia here?
Yes.
That's very tight. Is that too much or it's okay?
No.
That
Okay.
flask. Any difference working on the neck?
Doesn't feel as tight.
Okay. Did that change in your shoulder motion? Let's try it again. Or just help your neck? And let's do the side. Okay, bring it back. Let's go further. So move your neck around. How's that?
That feels better.
And backward. Did work on the neck help your shoulder, or just helped your neck?
I think it just helped my neck a bit.
Okay. So I will have you just sit here. Feel the scar tissue here. That's a
Mhm.
very big knot, very thick.
Yeah, when I went to the doctor for the
Uh-huh.
tendonitis, she said she could see a muscle spasm.
Yep. Like when you were like doing side bend, I can see your muscle spasm and I can see your fascia restrictions, like a bang.
Mm-hmm.
But here, you feel this knot. This is
Yes.
a knot. Like that's a
Yeah.
scar tissue. So I'm trying to make sure this is not painful. How does feel?
Painful.
Sorry. Make sure you tell me, okay? Okay. Let me go around. What about now?
No,
It's not painful?
no.
Okay. So actually we know when you feel pain, that's a sign of localized inflammation there. So, you know, when you have open wound,
Mm-hmm.
do you rub it?
No.
Because it's very inflamed, you're gonna feel
Mhm.
more. So if this is internally, it's open wound. What do you think? You don't
Don't
wanna,
worry about it.
you don't wanna rub it, you know. And that's the inflammation. Sorry.
It's okay.
You feel that scar tissue?
Yeah.
Okay, it's around your scalp right here. It's really big knot.
Thanks.
Sorry. Okay, let's drink some water. And tell me how that feels. Front. Any difference?
Feels like I can start to go higher.
Mm-hmm.
My thumb's getting higher.
Okay, what about the side? And bring it back. How's that?
Feels like I can go a little farther without it hurting so much here.
Okay. Alright, so I'm gonna jump to work on the inflammation. See how strong this magnet?
Wow.
Yeah. No seizure, yeah? No seizure,
No.
epilepsy or anything?
No.
Okay, so if you have mild inflammation in your shoulder, few minutes with the magnet heal should be enough.
Okay.
Okay. If you have moderate to severe, you probably will need more time with the magnets. Okay.
Okay.
So we're gonna know how bad is your internal inflammation here.
Okay.
And the other thing is, if you have vitamins, minerals, or hormonal imbalance, that sometimes slow down the healing in the shoulder.
Mm-hmm.
So after we finish, I gotta do nutrition analysis to see if you have any
Okay.
deficiency or anything missing in your diet, to make sure you have everything that your body needs to heal.
Okay. I feel like improvement in my elbows coming in
Coming
instead
in
of
more
out.
out, okay.
Mhm.
So definitely working on the inflammation, you start to have more range of
Mhm.
motion. That's what you feel.
Mhm.
Okay, let's do the side. How's that? Look at this.
I mean, it pulls, I can feel
You
it
feel the
pulling
pulling
across
here?
there, but I
Okay.
can
You
go
can go
higher
further.
before I feel
Let's
it
bring
pull.
it back, back like this.
Make it the same.
Okay. So let's do the front and tell me where do you feel the pulling.
Across here.
Okay, but that's a better range of motion.
And then
Okay.
a little bit there.
Okay, we'll have you relax. You felt it in the joint or just a line in the muscle?
I feel it like that line and then across here. Feels like the shoulder joint.
Mm-hmm. Yeah, that's, well, usually with the frozen shoulder, it's inflammation in the shoulder joint.
Okay. And then like the elbow, like
The
the
elbow
elbow
in the
joint.
back, yeah,
Mhm.
okay. So let me do this. Come up. How's that?
A lot better.
I'm going further.
It's like just hurts there.
Mm-hmm.
Just a little bit of pull across there.
Okay, let's do the side. Okay.
There, it's across there.
So it's right on the joint here, yeah?
Yeah. And then
Too much?
across there.
Mm-hmm. Is that too much? Did you feel better? Did you feel a difference from starting today?
Yes.
What's the difference?
I don't feel as much of the tearing
The
throughout.
pulling, yeah.
Yeah.
Mhm. Okay.
I feel my elbow
Mhm.
when I try and do the different things where my elbow wants to stay
Mhm.
out.
Mhm.
Before, just when I sit in the chair,
Mhm.
it felt like it was pulling everything
Falling
down,
down, okay.
and I couldn't hardly hold my hand on my lap. And
Okay.
now I feel like I can
Just
hold my
relax it.
hands. Yeah.
Okay. Right, Rebecca, this is your third visit
Yes.
for frozen shoulder.
Mm-hmm.
Can you give me an update how you feel?
I feel great.
Mhm.
Much improved. Things I couldn't do on Monday, I can do today.
Okay, so 3 visits back to back.
Yes.
Yeah. Mhm. So can you show me your range of motion now? Like bring it up and So how does that feel?
Good. Just a little bit of tightness there, but otherwise,
No pain?
no pain.
Beautiful. And let's do the side. That's nice. And then remember the other one that was tight is really this way.
Yeah.
Can you do this? Can you touch this part of your head?
Yeah. I can style my hair now.
Yeah,
I've been able to style my
yeah,
hair for a couple
yeah.
months.
So we're gonna take your range of motion
Okay.
now, and we'll have you line your back head here. Okay. So for flexion, how much we had the first treatment?
85.
85 flexion. Okay. So move your head this way. Okay. Bring it up as far as you can back. So that was 85. Now is 155. You see that?
Wow.
155. 3 visit for frozen shoulder. Okay. Abduction, how much?
70.
70. Okay. So 70. Let's bring it back and all the way back to your head. So look at this. Can you see it from the top? That is 180.
Wow.
3 visits of for frozen shoulder.
Yay.
Never heard of. Is that up for me? All right. So, what do you think about the treatment?
Oh, I think it's fabulous. I
Yeah.
just, for being in pain that many months, not able to sleep,
Yeah.
you know, not able to style my hair,
Mhm.
and now, you know, Monday the pain really subsided.
The first treatment when you start
Exactly.
working on it. Yeah.
Exactly, and so mostly like stiffness and,
Mhm.
and stuff, so
Mhm.
it's very exciting,
Yeah. Awesome.
big relief.
Yeah. Awesome. Thank you. Yeah.
Thank you,
Thank
thank
you.
you.
You need to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!